assure you, in those 30 years, I've been hospitalized 4 times. During those, also part of that issue is that I have had a difficult time in many periods in my life where I was not able to sustain employment. I've been fortunate because I've been saved by the safety net, public assistance and that sort of thing, that has enabled me to get the care I needed. I now work for a Fortune 500 company, and so I have the insurance that I need. I just need to let people know that someone with a serious and persistent illness, it's very stressful, and the idea that you wouldn't be able to have coverage, or you didn't have the coverage that you needed, that just adds to the stress. I know of friends that they are working for smaller companies, their insurance changes, they don't get the medicine that they need, or some of them actually get by through their psychiatrist and give them a month's worth of samples till they can get their insurance back in check. I just want to say that it would be wonderful to know that the insurance exists regardless of your employment situation, or if you're underemployed, which I have been many times in my life. I just know that I'm grateful. I'm very grateful to be here. I'm grateful for the insurance and the coverage that I was able to get, and I think that a public option it just would do so much for so many people like myself, people who don't want to come out and talk about this because it is shameful, because people are afraid, and there's nothing to be afraid of. I mean, if you get the treatment you need, you're able to function in society and you're able to contribute. And that's what it's all about. And I just want to thank everybody for coming out, and I appreciate the opportunity to say my piece.
I too suffer from depression and have had it since 1993. But I've been very fortunate to have good health care, good therapy, good medication. So I've been able to be a contributing person to society. I was a teacher for 28 years, and then I was able to do training, and I retired 3 years ago. And when I retired, my depression returned, and I couldn't figure out what's the matter with me. Why can't this depression lift? What do I need to do now? And then I finally realized that I was so upset with all the political crap going on. And all of the baloney that we had been sold, and how we had been told we must be patriotic as we invaded Iraq, and all that kind of crap. And once I realized that, I began to feel better. I found MoveOn.org, and that has been my voice, and I would really like to encourage you to also become involved with MoveOn.org and help us continue planning events like this. We're in there for the long haul. We're looking for some progressive changes. We want to represent the people that are not wealthy and not well connected. We are your voice, and I am giving back because I have received so much, and I have met so many amazing people in my work with MoveOn.org, and I thank you all for being here, and I wish that you would all join me in this wonderful work of shoulder to shoulder, where we stand up and say, these elected people must be accountable for their actions. All right.
My name is Mary, and at the age of 31, without a job or insurance, I was diagnosed with colorectal cancer. I had noticed some problems for months, and finally went to a free clinic where it was diagnosed as stage 4. Which is the one before dying. I have gone through, because of that, all of the public aid. Luckily, I was able to get on Medicare for temporary disability. I've been a survivor now for 7 years, and I am so grateful that I was able to get the help I was, and able to, this sounds terrible, but I'm so glad that I got my cancer when I did, because if it had been a year later, I wouldn't have been able to get help from the state. More importantly, I want to share the story of my mother. My mother and father moved away to Nevada 9 years ago. And shortly after moving there, my father developed breathing problems and lung problems. And for almost the whole time he was there, he steadily went downhill, and my mom was taking care of him. Luckily, he was a vet, so he was able to get taken care of at the end for him by the VA, and they treated him very, very well. Shortly after he passed away, my mother was diagnosed with bladder cancer. This was last year. She had been putting off paying for the house to pay for Cobra, which was expensive for her, so she was in effect losing her house in Reno, Nevada. I went out there to help her all year long with her treatments, with her doctors, with trying to get help for her. She was 62, and she was not able to get assistance because she wasn't 65. You are eligible for Medicare if you're under 65. She didn't have 24 months. She died May 27th of this year. And she decided not to have treatment, partly because of what she saw me go through, but also very much because, and I know she went through it because I went through it too, she was thinking, how am I going to pay for this? Yes. How am I going to pay these thousands of dollars to have poison put in my body to try and get rid of this killer cancer? And I'm going to have to spend the rest of my life trying to pay that off with no home. It was very heartbreaking to watch her slowly go into depression after she realized that she had been a United States citizen, had been paying into the system since she was 16 years old, and was told that she was not good enough to get coverage or help. I know that the public option is not perfect, but it's got to be better than what we have now, folks.
Yeah. Yeah. Thank you.
Just all the artists are just really